Here at Westchester University, in our undergraduate athletic training program, our therapeutic modalities class is where I teach the foundations, principles, physiological benefits, and clinical applications of IASTM. So in therapeutic modalities lab, our students spend numerous classes getting familiar with the HawkGrips tools, as well as learning how to implement them on patients. Additionally, in the graduate curriculum, I'm currently teaching a special topics. It's a soft tissue manipulation and mobilization course. We're going to be looking at a whole host of soft tissue techniques, where IASTM is going to be a central, certainly a central component to that class for the graduate students. Students are really eager to try new techniques. They want to be exposed to, they want to have a really large set of tools in their toolbox. And once the students see the positive clinical outcomes that IASTM yields in decreasing pain, improving range of motion, improving function, and muscle strength, they really are just sold from the beginning. So the response from the students is always of enthusiasm and eagerness to learn and apply the techniques on real patients. From a patient perspective, the technique and the tools really sell themselves. When I have a patient experiencing pain from a chronic overuse pathology, I can typically override that pain sensation in one treatment. And what that allows me to do is then take them through functional ranges of motion and activities that they wouldn't be able to do otherwise due to that pain. So I would say one of the biggest areas that I see immediate gains is in the painful response. And once that happens, patients are immediately asking to have this treatment done again and again. And although it's great that they ask for it, I certainly want to drive the decisions myself. So that's easily done. As soon as I see the improvements, I obviously then incorporate into their daily treatment. And then of course, being in a college environment where one person sees something being done and they share their positive experiences, all of their teammates of course run to me and say, I have this problem, can I get treated with this too? And when indicated, obviously I use this a lot in my daily practice. One of the biggest maybe myths or gaps in our understanding of IASTM at the present time with clinicians, I believe, is a lack of understanding of really knowing how much research is actually out there on IASTM. There are several, over a dozen, moderate to strong randomized controlled trials that I would highly suggest clinicians find and read, because right now I think with IASTM, the popularity in the clinical practice is there, but what's lacking is clinicians having access to or knowing that good randomized controlled trials and critical appraisals are available. So when it comes to pain, range of motion, function, and strength, the evidence is out there to support its use, and we're finally at the point where the clinical popularity and the research is starting to marry, and I really think that's a great thing, not only for any new technique, but for the IASTM technique in particular.